Whatever. She goes into
All right, so like we said in class today, we're going to be talking about the endocrine system. And the endocrine system is the system of glands in your body that makes hormones. And remember that hormones are signals. That's their job. They're like communication signals. And how do they get from one place to another? The bloodstream, which means they go to all your cells. But do they affect every cell? No. A specific hormone only affects certain cells in your body, right? Only the cells with what? The right receptor. And what do we call those cells? Cells that have a receptor for a certain thing. They're called target cells. So we'll talk about those in a minute. One thing you need to be able to do, though, is label a diagram of the endocrine system. These are the major glands in your body. And let's start in the brain. Let me go to another picture that kind of zooms in on that slightly. Again, it doesn't zoom very well, but a little bit here. There's three things in the brain that you need to know about in terms of the endocrine system. Let's start with sort of the main structure. It's called the hypothalamus. And notice it's right in there. It's the blue area in the diagram, sort of the center of your brain. Yeah. And we've talked about the hypothalamus before. What did we talk about it before in terms of? It maintains homeostasis. It helps to regulate things in your body. And one of the ways that your body helps to maintain homeostasis is through hormones. If something's wrong, something's not where it's supposed to be, these glands send out hormones and tell your body to fix it. So that's one of the things the hypothalamus does. We might think of the hypothalamus as sort of the leader of the endocrine system, because it actually sends out messages to tell certain endocrine glands to do certain things. Sort of the boss. Just underneath it is another really important gland, and it's the thing in red here. Notice it's right in that area. It's called the pituitary gland. You might think of it as sort of the second in command in the endocrine system. Those two structures, the hypothalamus and the pituitary, pretty much control what all the other glands do. And we'll get to how they do that in a minute. But in addition, the pituitary makes a lot of hormones. For example, HGH, better known as human growth hormone. And we'll talk about some others also. In the kind of the back of your brain, right in the green here, which would be somewhere in this neighborhood, is the pineal gland. I'll write it there. See it. The pineal gland helps to control what are called your circadian rhythms. I think we've talked about those in here before too. What are those? What are your circadian rhythms? Yeah. Not really your heartbeat. This is what we call your sleep-wake cycle. And you kind of got an internal clock. And the circadian rhythms are sort of that system of when you tend to get sleepy, when you tend to wake up, when you tend to be hungry, when you tend to be thirsty. It's just normal, timely order of the way your body works. It's your body's built-in biological clock. We'll talk about that a little bit later as well. Let's go back to this main picture here first. In your throat area, right around your Adam's apple, is the thyroid gland. Anybody know the most important thing the thyroid gland helps to control in your body? It's about your metabolism. It makes hormones that help to control the rate that you do cell respiration at. It does some other things too, but that's the main thing. That's the one we're going to concentrate on right now. Attached to the back side of the thyroid are the parathyroid glands. There's 4 of those. They're on the back side of your thyroid. And they help to control the levels of certain minerals in your body. Calcium, phosphorus. And again, we'll get into the specific functions in a minute. It's kind of hard to see where the parathyroid is, but it's on the back side of the thyroid. Little bitty dots. What's the bone that runs right in here? The sternum, right? It's the sternum. Right around where your sternum's at is another gland called the thymus. Don't confuse that with the thyroid. They're actually kind of close together. The thymus gland makes hormones that help to develop your immune system. When we were talking a little bit about the immune system in class today, remember we talked about helper T cells? There's other kinds of T cells too. Guess what the T stands for? Thymus. That's where they develop. That's where they... sometimes I'll compare the thymus to like a dojo. You guys know what a dojo is? What's a dojo? It's like where ninjas train, right? It's where ninjas train. So the thymus is where your ninjas train, your immune system. It's where your immune system cells learn to kill, essentially. Your thymus gland. Going on down, right in this area, these little bean-shaped things. What are those? The little bean-shaped things. Those are your kidneys. They're not generally considered to be endocrine glands. But on top of each kidney is this little mass right here and right here. Those are your adrenal glands. And obviously they make what hormone? Adrenaline. But in addition, they make several other hormones, which we'll get to a little bit later on. But for right now, adrenal glands on top of your kidneys to make adrenaline. The pancreas, which we've talked about several times, right in there. What are the two pancreatic hormones that we talked about?
Insulin.
Insulin, and what's the opposite of insulin? You're close. Glucagon, Glucagon, glucagon. So those are very important in controlling your blood sugar levels, and we'll get to those as well. And then we've got the gonads, which are either the ovaries or the testes, and we'll talk about what they do as well. So those are the major endocrine glands. Be able to label those on a diagram. What's that? Yeah, it's just like it says. So just the sex organs, essentially. All right, so just a little stuff in general about the endocrine system. Most of this you probably already know. First of all, they're ductless glands. What do we mean by a duct? Tube, a pipe. There's another set of glands in your body that are called exocrine glands. Now these are different. This is the kind of opposite of an endocrine gland. What would be an example of an exocrine gland? A gland that has a tube that takes what it makes to where it's supposed to go. The sweat glands. They have little tubes that take the sweat up to the surface of the skin. Turns out your pancreas is both. Your pancreas is both of these. If it's endocrine, it makes hormones and dumps them directly into blood. The glucagon and the insulin, that's the way they work. They're made by the pancreas, straight into the blood. But what else have we talked about in here before that the pancreas makes? Besides those hormones. Really important. Okay, not the acid, but it makes your digestive enzymes. They have to end up where if they're going to work? Not the stomach, the small intestine. There's a tube that connects the pancreas to the small intestine. And that's how those enzymes get from the pancreas to the small intestine, is through that tube. So the pancreas is both of these. Most things aren't. Most things are one or the other. Either endocrine, where they make things and put them in directly into the blood, or exocrines, where exocrine glands, where things are made and sent to where they're supposed to go by a tube. Like we said when we started this discussion a minute ago, one of the main jobs of the endocrine system and hormones in general is to help you maintain homeostasis. A lot of hormones are about regulating the levels of certain things in your blood or in your body. We just mentioned insulin and glucagon, which help to control glucose levels in your blood sugar levels. There are other hormones which we'll talk about either today or next time that help to control the levels of calcium in your body fluids. There are others that help to control the levels of sodium. There are still others that help to control the levels of phosphorus. And we could go on and on and on and on and on. So one of the main jobs of hormones is to regulate concentrations of things. Yeah.
What was the Douglas gland?
That's what endocrine glands are. That they don't have a tube that carries their hormone somewhere. They make the hormone and it goes straight into the blood from the gland. So again, hormones are about controlling the levels of certain ions or certain chemicals in your body fluids. Homeostasis of certain chemicals. But there's some obvious other functions of hormones, such as controlling the reproductive cycles. We'll talk later about all the different hormones that are involved in like the menstrual cycle. There's several of them. Hormones also help to control when you grow and how much you grow. They're involved in milk production in a nursing mother. They help to bring on puberty in a teenager. They help to bring on metamorphosis in an insect. Turns out metamorphosis and puberty are really similar things. There can be cancers of the endocrine system, and we'll talk about those later. If you remember in class today, we saw a picture, some of you did, maybe not all of you, of the tallest man who ever lived. Anybody remember how tall that guy was?
8 feet 11.
He's like 8 feet 11 and a half, almost 9 feet tall. He had a cancer of his pituitary gland, and that's one of the reasons that he made all those growth hormones. A lot of these guys who you see that are over 7 feet tall, that's why they're over 7 feet tall. A lot of times they have cancer of the pituitary. And you guys have heard of pancreatic cancer, right? It's one of the most serious forms of cancer you can get. We'll talk a little bit more about the cancer issue later. All right, a couple more things that we'll mention today, just general kinds of things about the endocrine system. Hormones, most of them are protein-based kinds of things. They're either short amino acid chains or they're full-out proteins, one or the other. There are a few hormones, though, that are steroids, which means they're what kind of things? They're lipids. And that's going to affect where what's at for those hormones. Where the receptors. If it's an amino acid or a protein-based hormone, it's going to be the receptors are going to be on the cell surface on the outside. If it's a steroid-based hormone, those receptors rather are usually going to be on the inside of the cell. Hormones can be released based on a lot of different things. Hormones can be released based on like external stimuli, like what's going on in the environment. They can be released on some kind of neural signal. Or other hormones can cause hormones to be released. And we'll get into all that. How a certain hormone can be released based on your environment, based on what's going on with your nervous system, or based on what's going on with other hormones. And one of the most important things I want you to leave here today knowing, something that I hope you already know to some extent, is that a lot of hormones are regulated by negative feedback. And I want to make sure you know what negative feedback is before we leave today. So I'm going to go to a diagram here first. And we're going to talk about negative feedback for a minute. All right, here's sort of the chain of command in the endocrine system. Like I said before, the boss is the hypothalamus. Kind of second in command is the pituitary. And for right now, let's say that this target gland, let's just say this is the thyroid gland. And what do we say the thyroid gland is about mostly? Metabolism. It makes this hormone called thyroxine, which helps to speed up metabolism, cell respiration. So let's say for some reason or other, your thyroxine levels are too low, which means your metabolism is also too slow, right? You don't have enough thyroxine, your rate of metabolism is too slow, your body says, whoa, got to speed up metabolism. So the hypothalamus, you want to think of it sort of like your body's thermostat. It notices that the cell respiration rates in your body are too low. So it's going to send out a signal, an order essentially. This is essentially an order. And that order goes to the pituitary gland. And essentially it's saying, okay, pituitary, our cell respiration is too slow. I need you to take care of that right now. So the pituitary says, yes, sir. And the pituitary sends out his own order, a different hormone. It's called a stimulating hormone. In particular, this particular one is called TSH, which stands for, guess what? Thyroid stimulating hormone. And it's an order, basically telling the thyroid to do what? Get to work. Okay? Do what you're supposed to do, speed up cell respiration. So that order goes out to the thyroid, and in response to that order, the thyroid gland starts making thyroxine. Now where does the thyroxine go? Essentially to all the body cells. Pretty much all your cells have receptors for thyroxine because all cells have to be able to do what? Yeah, cell respiration. So essentially it tells all the cells to speed up the rate at which you're doing cell respiration. You want to continue to speed up and continue to speed up and continue to speed up and continue to speed up though. You got to have a way to stop the speeding up process. So what happens is that the hypothalamus is monitoring the levels of thyroxine. And when they get to a certain level, the hypothalamus says, okay, we're where we need to be. So it stops giving off this order. It stops barking at the pituitary. The pituitary is also monitoring the thyroxine levels. And when they get to a certain level, the pituitary says, okay, I don't need to be ordering around the thyroid anymore. So when it stops releasing this hormone, what does the thyroid stop doing? It stops releasing thyroxine. So that's why it's called negative feedback. Orders are given to do something. When the levels get to where they're supposed to be, what happens to the orders? They stop being given off, which means the release of that hormone stops. But nothing stops until you get to where? The set point, where you're supposed to be, the homeostatic point. That's the way most hormone levels are controlled in your body. Negative feedback. Does that make sense? Right, let's backtrack a little bit then. So just a couple of words. Remember that target cells are cells that have the right what? The right receptor. And I guess we'll talk a little bit today about maybe two glands, and then we'll call it a day after we talk about these two. Let's start off by talking about the pituitary gland. Remember, the pituitary is in your brain. It used to be called the master gland because we said before it's sort of one of the things that controls the other glands in your body. But really remember it's second in command because the hypothalamus is actually giving orders to the pituitary. I want you to think of the pituitary, though, really as two separate glands in one container. What's posterior mean? The back side. So the way that I'm standing here right now, posterior, what's the opposite of posterior? Anterior. The pituitary is divided essentially into a front and a back part. We're going to talk first about the back part, the posterior part. And notice what it says here. The posterior pituitary produces no hormones of its own. But what happens is the hypothalamus makes, especially these two hormones that are listed down at the bottom, puts those into the pituitary, and then the pituitary puts them into what? Into the blood. So the hypothalamus makes these two hormones that we're about to talk about, releases them into the pituitary, and then the pituitary will slowly release them into the bloodstream. One of them is antidiuretic hormone, and the other one's oxytocin. And we'll talk about both of those here momentarily. Anybody know what the word diuretic means?
Not urination.
Again?
Not urinate.
Not antidiuretic, just diuretic. Diuretic means make you go, make you urinate. What's a common diuretic? Looking to see if anybody has drinking diuretics right now. Caffeine, for example, is a diuretic. Alcohol is a diuretic. They make you go. They make you need to urinate. That makes you go another way. I'm not sure what it's a laxative. We're talking just urination right now. Yep. We'll just call it a laxative. So an antidiuretic means that it's something that helps to slow down the rate of urine formation. When would you want to slow down the rate of urine formation? Yeah. Let's talk about, a lot of times instead of calling it antidiuretic hormone, a lot of times this hormone is just called ADH. That's how I'm normally going to refer to it, ADH. Antidiuretic hormone. And essentially, its job is to reduce how much urine you make. So its target cells are in the kidneys mostly, because that's where urine gets made, right? In the kidneys. If you see this word osmoreceptor, what do you think that means? Osmoreceptor. Yeah, it has to do with a lot of times in this class, in this unit, we'll talk about what's called osmoregulation. ADH is important for that, osmoregulation. And that essentially means regulating the balance between what? What and what? Water and, not so much waste, but water and solutes, salts. Okay? Regulating the balance between water and salts, so osmoregulation. ADH is one of the main ways we do that. And essentially, if you're exercising a lot, you're going to start to make ADH. Because if you're exercising a lot, you're doing what a lot? You're sweating a lot, and your body's losing water. And if you're doing that on top of urinating a lot, you're going to dehydrate really fast. So ADH is going to be released when you're exercising a lot. It's going to be released when you're walking through the desert and you haven't had anything to drink for a long time. Because at that point, urinating could lead to death, right? It's going to dehydrate you. So in any situation where you're having dehydration issues, ADH is going to be released to help you conserve water. Keep water in your blood and in your body fluids. Something kind of strange is that alcohol inhibits ADH secretions. If you know anybody who drinks a lot, what else do they do a lot? They urinate a lot. Because alcohol keeps your body from releasing ADH the way it's supposed to. Alcohol will dehydrate you very quickly. And that's one of the reasons that people get like hangovers. It's because they're dehydrated. Even though they've been drinking all night, they've also been urinating all night. And their body fluids don't have enough water in them because they urinated it all out. Where else other than in this discussion might you hear about diuretics in terms of health? Not antidiuretics, but diuretics. Where might you hear about diuretics? Some of your parents or grandparents might be on diuretics. Sometimes if people have high blood pressure, they'll take chemical diuretics. The doctor will prescribe them. Why would that help blood pressure? Why would peeing a lot help your blood pressure? If you're urinating a lot, you're getting rid of a lot of water, right? Which means there's less water where? In your blood vessels. Less water should mean less what? Less pressure. So a lot of times people will be put on diuretics to lower the amount of fluid that the body is retaining and lower the pressure. All right, let's skip over and talk about oxytocin for a minute. Notice what oxytocin does. Causes uterine contractions in women. It's the main thing. Anybody ever been in a delivery room when someone was giving birth to a baby? One. A lot of times if they're going to artificially stimulate labor, they will actually hook an IV of this up to the woman. And this is how they cause the labor to get started. That's a natural hormone. Your brain is making it if you're pregnant. But if they give a woman extra oxytocin, it will cause her to go into labor. It'll stimulate the labor. It also causes milk to be ejected, to be like sprayed out. It's one of the few things in your body that its release is dependent on positive feedback. Let's focus on that for a second. Negative feedback's job is to always get you back toward what? Back toward the set point, back to where you're supposed to be. Positive feedback's job, though, is to do what? To make something happen fast. To move you away from homeostasis. To make something happen fast. And what I mean by positive feedback here is it's sort of like, think of it like a snowball going down a hill. Starts off small, gets bigger, 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 bigger. And the way that works with oxytocin is the woman's body releases a little bit of oxytocin, and that causes what to happen? It causes the uterus to start contracting. When the uterus contracts a little bit, what does that cause to happen? It causes more oxytocin to be released, which causes the uterus to do what? Contract harder, which causes even more oxytocin to be released, which causes it to contract even harder. And you get the idea. And that just keeps happening and happening and happening until eventually the baby's pushed out. Positive feedback. Men have some oxytocin too. And notice its role is, especially in men, is to promote affection and also arousal. So different hormones have different effects depending on where they're attaching, the receptors they're attaching to, and in what sex they're in the first place. But both of those hormones come from the back part of the pituitary, the posterior pituitary, but they're actually made by the hypothalamus, which is right above. So now let's look at the front part of the pituitary, the anterior pituitary. It makes several hormones as well. This right here is a whole category of hormones, tropic hormones. Tropic hormones, as it says on the PowerPoint here, are hormones that control other glands. So these, you might think of these like orders. This is when the pituitary is ordering around other glands. Tropic hormones. In addition to those, and we'll talk about several of those individually here in a minute, the anterior pituitary also makes growth hormone and prolactin. What's prolactin cause to happen? Prolactin. Lact. What's lact? L-A-C-T. Milk.
No, lactate means like for
This causes the woman to make the milk, and the oxytocin can cause her to release the milk. This is actually causes the milk to be made in the first place. All right, let's start off by talking about growth hormone, which we'll oftentimes call HGH, human growth hormone. Notice some of the effects of it. Stimulates bone elongation, accelerates fat breakdown, and also accelerates protein synthesis. And that's why you often see what group of people taking it illegally. Who takes HGH illegally? Yeah, a lot of athletes, because if it's accelerating protein synthesis, that means it's going to build up what? Muscles. And it's accelerating fat breakdown. So this makes you look really good really fast, because you put on muscle mass, you lose body fat. Now, if I was to get on HGH, is it going to make me grow in terms of height? No. Past a certain age, you're not going to grow taller, right? Once your growth plate's hardened, which you girls is probably already over for you, you're probably not going to get any taller. You guys, you might continue to grow until 25. literally. I'm well past that. I'm not going to get any taller. But what might happen if I took HGH? Muscles would get bigger. I'd lose body fat. But what else might happen to my bones? They get thicker. I'll try to pull up a picture in a minute. Do you guys know who Barry Bonds was? Or he is? Barry Bonds, baseball player. Started off back in probably the early 90s or so, playing baseball, maybe late 80s. Normal looking black guy. He just retired or sort of got kicked out of baseball, I guess, 5 or 6 years ago. And when that happened, what had changed about the way he looked? His forehead, the bone of his skull, got much longer. It started protruding. His chin got thicker, stuck out more. Cheekbones thicker. Completely changed because pretty much proven fact that Barry Bonds was on a concoction of illegal things. HGH, steroids, and that's why he was so good at hitting home runs. He was juicing, as they call it. Makes a big difference. It's also been shown that for athletes, it helps your injuries to get better faster because it does all these things which are important for healing injuries. But it's illegal in most sports. There are cases where people make too much HGH, and that's called gigantism, and a related condition called acromegalia, and we'll look at pictures of both of those in a second. There are also conditions when people either don't make enough of it, or when the receptors for it in their body don't work, and that's what different kinds of dwarfisms are usually related to. Is either not having enough HGH or the receptors for it not working the way they're supposed to. Let's look at this picture before we go further, and we'll come back to this. So, like I said, this guy's a normal sized guy. This is actually an adult dwarf. So both adults, around the same age, dwarf adult. This guy's probably seven, hop in sevens. This guy's probably 2.5, 3 feet tall. Both related to HGH though. This woman has what we call acromegalia. This woman's probably up near 7 feet tall, which is crazy for a woman, right? But notice as a child, she looks pretty normal, cute little girl. But what do you notice happening to her face over the years? Notice how her forehead is getting longer and thicker. Her chin is getting thicker. Her cheeks are protruding more. That's what happened to Barry Bonds. Now hers is happening because she has a tumor in her pituitary gland. So she's naturally making too much HGH. Barry Bonds, the same thing happened to him, but he was injecting himself with HGH. Completely different situation. Also notice the size of her hands. She's got huge hands for a woman. Huge, thick hands. That's what happens with acromegalia. Too much HGH over a long period of time. We already mentioned prolactin. Prolactin promotes the synthesis of milk by the mammary glands. It can also enhance testosterone production in men. It's another way athletes sometimes cheat, is they start taking prolactin, which causes them to make more testosterone. Because at least originally, when they started testing athletes for hormones, would they have tested your prolactin levels if you were a guy? Probably not. So they took prolactin, which then caused them to naturally make more testosterone. It's a way to cheat without getting caught. That's essentially what happened. But something else that's kind of strange that prolactin can cause, too much prolactin can cause gynecomastia. Any idea what that might be? It's when guys develop breasts, like female breasts. And some of these guys taking prolactin, that happened too. So they were trying to grow their muscles and they grew other things. There's a drug, there's one of these lawyer commercials where they're suing drug companies. Pay attention to these.
Like ADHD or something.
Yeah, and maybe it was an ADHD medicine that had this side effect. It caused this gynecomastia condition, and now there's a bunch of lawyers suing the drug companies for these people that this happened to. But imagine being a teenage boy on ADHD medicine and that happening to you. It'd be terrible. But anyway, you get the idea. This column of things over here on the right, these are the tropic hormones that the pituitary makes. And remember, tropic hormones are hormones made by the pituitary that control other glands in the endocrine system. They're like orders. For example, this one right here, ACTH. That stands for adrenocorticotropic hormone. Which essentially means it's an order to what gland? A certain part of your adrenal gland, the cortex. We'll talk about what the cortex is later. But it's essentially an order to the cortex of the adrenal gland saying, make your hormones. Do it now. TSH, we already mentioned. It's an order to the thyroid. Thyroid stimulating hormone. Make more of your hormones, speed up what? Speed up metabolism, speed up cell respiration. There are also hormones related to like reproduction. FSH is an important one. And that stands for follicle stimulating hormone. And essentially that causes you to either make eggs or make sperm, to develop the eggs and the sperm. Follicle stimulating hormone. And then one other tropic hormone we'll mention is LH, and this will come back when we get into like the hormones of female reproductive cycle. The L stands for luteinizing hormone. We'll talk about what that means later as well. But essentially, this hormone causes you to make estrogen or testosterone, depending on what sex you are. But the other thing about it is it triggers ovulation. When in a woman's cycle is ovulation supposed to happen? How long is the cycle? It's about 28 days. The total cycle is about 28 days from start to finish. When should ovulation happen in that cycle? Right in the middle. Okay? Day 14. Okay? Day 1 is when the bleeding starts. That's day 1. About 14 days after that, ovulation should happen. And it turns out that right around the 13th or 14th day of the cycle, there's a huge surge of this hormone, and that causes the ovary to release the eggs. Ovulation. LH. So this is just kind of summarizing some of the hormones. Notice it breaks it down into posterior and anterior pituitary. So the posterior, again, is releasing the ADH to slow down the rate of urine formation. It's releasing the oxytocin to cause contractions of the uterus or to cause release of milk. The anterior part releases the thyroid stimulating hormone, the adrenocorticotropic hormone, prolactin, which causes milk to be made, growth hormone, and also the gonadotropins like FSH and TSH, or LSH, or LH. All right, we got time to talk about one more here real quick, and that will be the thyroid. All right, and I'm not going to probably get through this because I need to get out here at 5 or 4:25. But the thyroid gland, first of all, is stimulated to release its hormone by TSH. And again, TSH is coming from where? The pituitary. Pituitary, it's telling it to go to work. The main hormones made by the thyroid, sometimes you might hear them called thyroxine or triiodothyronine. Together, though, we call those two thyroid hormones. And they tell your body to speed up cell respiration, speed up metabolism. One kind of unique thing about the thyroid gland is as far as scientists know, the only place in your body that needs iodine is the thyroid. What happens if you don't get enough iodine in your diet? Yeah, you get what's called a goiter, which is fat. So your thyroid gland swells up if you don't get enough iodine in your diet, and it's probably painful. Sometimes it has to be corrected surgically. You don't see that in the United States, though, right? You've never seen anybody with that, probably. Why don't we get that in the United States?
It's inside.
They add iodine to salt, and we all get too much salt. So iodine is typically not a problem in the U.S. Yeah.
That happen like over time, or would it be kind of?
Yeah, it happens over time, but I don't think it's that long of a time, but probably days, maybe weeks. So it's a cool hairdo there too, right? Mutton chops. Thinking about growing some of this. Anyway, as we said before, the thyroid gland helps to regulate metabolism by stimulating glucose metabolism. It speeds up the rate at which you burn glucose. And it's one of the few hormones in your body that affect just about every cell. Almost every cell in your body has a receptor for thyroid hormone, because all cells have to do cell respiration. Now you can get hyperthyroidism or you can get hypothyroidism. If you have hyperthyroidism, what kind of symptoms are you going to have? Hyperthyroidism. You're making too much thyroid hormone, so that means what's going to be too high? It means your rate of respiration is going to be too high. Your metabolism is going to be too high.
Don't you have to go like go to the doctor to get it fixed?
Yep, but that means that you're probably going to be continually losing weight. You're going to have a heart. You can eat like a pig and still lose weight. You're also, though, going to be kind of jittery, shaky, hyper. On the other hand, if you have hypothyroidism, what are you going to feel like? Your metabolic rate's really slow, so like smelling a hamburger will cause you to gain weight. I'm being sarcastic. You get where I'm going. You don't have to eat much to gain weight because your metabolic rate's really slow. You're going to feel really lethargic. You're going to be tired all the time. You're going to have any energy. Would not be a good feeling. One form of hyperthyroidism is Graves' disease. That's a form of hyperthyroidism. And it's an autoimmune disease. Graves' disease. And it's where certain antibodies in your body, so you've had some kind of infection, and these antibodies that your body has made are shaped a lot like TSH. In your body, your thyroid can't tell the difference. So if you have antibodies that look like TSH, what does your thyroid do? It makes a lot of thyroid hormone. It speeds up your metabolic rate. So you get elevated metabolism, you're really nervous, you get weight loss. Sometimes you get this really bug-eyed appearance, like it looks like your eyeballs are popping out of your head. Kind of strange appearance. We'll talk next time that the thyroid also has a role in terms of regulating calcium and phosphorus levels in your blood. Well, we're going to stop there for today. We'll pick up next time. Let me stop this real quick, and then I'll get your question for you.